Okay, ladies and gentlemen, it's time for our next presentation. This is Missourians Trust Their Healthcare Providers, findings, recommendations, and discussions from a statewide survey of vaccine perceptions and behaviors. And so I'd like to introduce Ms. Katrina Starnes and Ms. Lana Hudanick. They will be doing a joint presentation today. Katrina Starnes has more than 20 years of experience conducting specialized research projects and communicating insights across multiple industries, with an emphasis on engaging hard-to-reach populations, improving health outcomes, and nonprofit program effectiveness. She is passionate about leveraging research to make a difference in the world. Katrina serves as the Senior Research Director at Lambert in St. Louis, Missouri. She has a BS in Business Management with a minor in Interpersonal Communication from the University of Evansville and holds an expert-level researcher certification with Insights Association. Ms. Lana Hudanick has worked in public health and immunizations for over 20 years. Currently, she works as the Immunization Quality Improvement Coordinator, Adolescent and Flu Coordinator, and Educational Partnership and Program Effectiveness Coordinator. She has worked for the state of Missouri for 10 years. Lana has a BSN from Missouri Baptist University and an MPH from from Ohio University in Athens. So let's greet Ms. Starnes and Ms. Hudanick.
Thank you so much. I am Katrina Starnes, and Lana, will you wave? There you go, yes. She says she'll join me later. She's gonna leave me up here by myself right now. No, it's all good. Thank you all so very much for being here. I hope everyone is awake after lunch. I'm gonna push the clicker button. Hopefully it will advance. We don't have to look at that now because you already know who we are. So we were very, very fortunate at Lambert to partner with DHSS as they began working on a communication initiative about vaccine awareness and acceptance in the state of Missouri post-COVID. And so we worked alongside each other to understand the new ecosystem that has emerged and how communication and support work in a post-pandemic world. So we knew that we had a challenge. As all of you in this room know, that the declining vaccination rates threaten public health, and that is something that was highlighted by Linnell earlier this morning. The factors are multifaceted in that the ecosystem that we are facing is socioeconomic barriers, vaccine misinformation, public distrust, and the vaccine skepticism that exists around the COVID-19 vaccine. So what we felt as we were collaborating together was that we really needed to understand the lay of the land, depart from what we need to know. And that really became a list that you'll see here that was really trying to understand where Missourians sit today in their level of confidence in vaccines and their awareness of them, impact of the factors that they face, the role of healthcare providers themselves in the decisions that are made around vaccines. What are those trusted vaccine information resources that Missourians are depending on and looking to when they make their decisions? What are the demographic and cultural factors that are a part in playing roles in the impact around vaccine decisions? And then also, what are the best communication methods and the information requirements that people need to make the decisions, the best possible ones for their health? So before we start developing a communication campaign, we're like, we gotta talk to people, right? We gotta get to know where they are today. And this became a multi-phase initiative where we focused on talking to Missouri residents through both online focus groups, doing a massive online survey to make sure we heard from a very large representative population of the state in a variety of areas, doing in-depth interviews with physicians, nurses, and pharmacists, and also doing focus groups with the community health partners in their respective areas of the state. And also then doing an online survey with actual healthcare providers as well. So this helped us present a very comprehensive picture of the lay of the land. We did 11 online focus groups representing all the regions of Missouri, and we made sure that we had specialized groups that were focused on high social vulnerability index areas. We also did specialized groups around parents, those who were uninsured and underinsured, those who were living in rural areas, and then those who were identifying as Black, African American, Hispanic, Latino, Latinx, Asian, and other ethnicities to make sure we really had a large and very comprehensive picture. We heard from 950 online survey responses, and that also included representation from many of these groups as well. We did 16 healthcare provider in-depth interviews, and this really focused a large gamut of primary care physicians, internal medicine, pediatrics, pharmacists, and nurses and nurse practitioners. We also spoke with those who were in metro and rural areas, including high SVI. And then we also made sure that we heard from community health partners across the state. Those were also from those local public health agencies, and especially also in metro, micro, and rural areas as well. And in our online survey, we made sure to talk to a large variety of healthcare partners, and that's where we reached out to physicians, nurse practitioners, those who were physician assistants, and then also those who were RNs or pharmacists in all of these different areas like OBGYNs. We made sure we heard from pharmacology, pediatrics, and primary care. Whew, that was a lot of work. But we learned a lot. And I just want to celebrate all of you who have been on the front lines. I know it feels like you probably have been through a war over the past few years. And I just want to applaud all the tireless effort and work that has gone on in all of your respective communities. Because we really heard that loud and clear, is that the healthcare providers and the community health partners have been working tirelessly. And this is where patients have had more questions and greater hesitancy, and it has been hard. And we also wanted to understand Missouri citizens. And this is where they said, you know what? The most trusted voice in the room is my healthcare provider. And that was amazing because it was helping us understand that the linchpin in their decision is not social media, it's not their friends, it is you. And I felt as a group, and we felt as a group, that that was so encouraging and needed to be one of the biggest things that we would highlight for you today in this conference. They see their healthcare provider as the most trusted resource for vaccine information among all the information sources that are out there. And so both Missouri healthcare providers and Missourians themselves have been impacted, as we all know, by the shift in public sentiment and all the chatter and loud noise. And there are differences that do emerge when it comes around their perceived frequency of how often vaccine conversations happen. But I hope that as we kick this off, you can be encouraged to know that you guys largely agree that vaccines are important. So the importance of vaccines, we had them rate all the individual vaccines, and on average, it was an 8.2 out of a scale of 10 as far as being important. And both healthcare providers are like, yeah, vaccines are important to health, and largely Missourians agree with you. There are obviously differences across different vaccines, but the most important call out are that these top 5 vaccines are viewed as most important by both healthcare providers and Missourians. So there is a point of departure of great levels of agreement. That can be a place of having conversations and departing from. So we wanted to highlight that there is large levels of agreement, both for themselves and for their children's health. However, as we always know, there are some differences, and it's important to know what those are. while nearly all Missourians are getting vaccinated and their children vaccinated, they're not keeping up to date, which I'm sure I'm preaching to the choir here, but at least the data agrees, both here and what we're seeing in your data sets. They all say, well, yeah, I get vaccines, but only about 2 out of 3 say they're up to date or mostly up to date. And parents of minor children, they're a little bit more likely to take care of their kids than themselves, which may not be a surprise. For those of us who are parents, that seems par for the course. But what's interesting is that, there are those parents who are basically saying, it's only if it's recommended. Like, if my healthcare provider tells me, like 1 out of 6 of them are saying, it's a case-by-case basis, or if my healthcare provider tells me I should. So there is this percentage of folks who really kind of need your voice to help guide them to make that decision. And parents who are in those high social vulnerability index counties are 2 times as likely to say their kids are mostly up to date. So those are areas of greater vulnerability in the population. But there's another point of departure around agreement that we want to highlight. Discussing vaccines is expected, and most Missourians and healthcare providers say, yeah, we're comfortable having these conversations. So the vocal minority is still the minority. Those folks that are coming in and have questions, they kind of expect that conversation to happen, and they're open to it. The vast majority. And it said 94% of the healthcare providers are saying, yeah, I bring them up, and 94% of Missourians say, yeah, I kind of expect them that they would mention them to me. And they're saying, yeah, 8 out of 10 or 85%, they're like, yeah, we're comfortable having this dialogue and this conversation. But what's interesting, and I'm sure that this is probably not a surprise, is that healthcare providers feel like I talk about this all day, right? I'm always talking about vaccines. This is always happening very, very frequently, right? 72% of them say, I bring up vaccines every day or more often. But unfortunately, Missourians themselves say, well, only about 1 out of 5 said, yeah, every time I'm with my healthcare provider, we talk about it. And I know that can largely be from perception. You as the healthcare provider are sitting there and talking and talking and talking all day long with patients, and it just may not be a normal rote part of every conversation, but it feels like it is. And so that was interesting for us to understand that frequency of actual conversation may not be as frequent as it feels like for healthcare providers, because Missourians are saying, well, it doesn't happen every time, 80% of the time. It's much less, it's less frequent than every visit. And it was interesting when we're looking at people of color, especially the Black and African American and Hispanic and Latinx residents, they said they're the ones who have a less of a comfort level in having these conversations. And so just being sensitive to that and realizing that curation of accessibility and creating a comfortable environment for some of other residents might be important to have in thinking about those things. And it said that was one of those things where they said, as far as 6 out of 10 Missourians said that vaccines are only discussed if they have a question or concern, or if the healthcare provider is the one initiating that conversation. So it's important to note that the patients themselves, Missourians may not bring it up, but if they have questions, they do recognize that their healthcare provider is willing to have the conversation, but it can be more strongly led by healthcare providers. And it is expected and mostly anticipated that that would be something that would be talked about with a healthcare provider. Another point of good news, we want to focus on some good news, right? This, again, just celebrating the fact that out of all the voices in the room, healthcare providers are the most trusted resource, and that most Missourians are saying, yes, I'm open to having that conversation. So I just want to let you all know that there's that negative minority, the voices that are loud are not the bulk of the population that you're serving. I know it may be difficult, and we know it may be hard, and we've heard that, but I just want to point this out, that there is a large space and opportunity for conversation and openness to that, and that you are the one they trust. But we know that this is not happening in a vacuum. And it was painful, but hardly unexpected, to see that although Missourians see long-standing routine vaccinations as important, the COVID-19 pandemic and the vaccine rollouts and everything, has been an erosion of public trust. And Missourians feel it, and healthcare providers feel it. And so they are acutely aware that it just feels like a more negative environment around vaccines. And 7 out of 10 healthcare providers say, I'm just concerned about having these conversations with patients. We heard frustration, discomfort, exhaustion, and worry as you all are engaging with these more skeptical and distrustful patients. And so we understand that about 1/5 of those that filled out the survey from a healthcare provider's perspective said, yeah, we're shifting how we approach these conversations. A lot of them weren't. But this was where we said, maybe this is where we can depart from, and we look at the places where we can agree and where we can focus on what's most important and cultivate dialogue that is more positive and engaging for both parties. Because as we can see, even though these percentages are high and these feelings are hard, these are still not the majority, right? 80% are open and want to have these conversations and want to be able to ask their questions. We all know it's beating a dead horse. COVID-19, it's the vaccine that's generating all of these questions. It even has reticence within the healthcare community in saying that some of the providers, 1 out of 4, were saying, you know what, it's just harder for me to just come out straight and be confident about recommending this. And that is ones they just want to have conversations and dialogue and be able to ask their questions about it. And this creates a very challenging communication environment, and we can just, acknowledge the challenge and the elephant in the room rather than ignoring it and missing out on that opportunity to rebuild and re-engage and build trust. So when we ask Missourians about what their biggest concerns were, right, safety, efficacy, and side effects were the top 3, and really just said, but the good news is that the vast majority, 3 out of 4 of them, were saying, yeah, vaccines prevent disease. We agree with that. That isn't a massive point of disagreement. We agree that this is helpful. But we do have challenges around that particular agreement with those who are in high SVI and rural counties. So we know that that's a challenge that we're going to have to rise to meet. Half of Missourians say, yeah, vaccines are safe. They agree with that. But rural residents are 2 times as likely to not share that and believe that vaccines are unsafe. So that's another challenge. And more than half of Missourians believe that vaccines have concerning side effects. And this is part of that misinformation, that dialogue, and that negative voice in the room that needs not to be ignored, but communicated and engaged with and empowered. And knowing that the healthcare provider is the most trusted voice in the room, you are the ones who can have the greatest impact in helping people and these Missourians and these patients to make better health decisions and not feel so frightened. And I know that's a big lift, but of all the voices that are out there, it's yours that matters most. We do recognize through the research that Black and African American and other racial and ethnic groups were much more likely to have concerns about safety. And more than half of the Missourians in high SVA counties were the ones that were like, yeah, there's concerning side effects. So we recognize that some of those areas with the greatest challenges are the ones that are going to possibly need a little more attention. But it's not all bad news. That's, at the end of the day, we at Lambert and with DHSS really want to provide encouragement here. And I know it may not always feel that way, but you all really matter hugely in this patient outcome and decision-making matrix around vaccines. You're the one who matters the most. to the person making that decision for themselves or for their child. Missourians and healthcare providers have both said, we're willing and open to have these conversations. The vast majority. There's not this don't talk to me thing that's happening across everyone in the big population of Missouri. It might feel like that, but it's not the truth. Most are willing and open to have those conversations, and they agree that vaccines are important to personal health and for their children's health. There are points of agreement that can be met and be points of departure for these more positive conversations. And Missourians trust their personal health care providers more than any other vaccine resource. We literally had a list of like 14 of them, okay? So it wasn't a short list. It wasn't stacked in your favor, I promise. It was rigorously designed, but your voice matters the most. And the negativity and sentiment, while it does impact both Missourians and healthcare providers, it is important to remember that the vocal minority is still the minority. And patient questions and concerns can be used as gateways to restore trust in vaccines. These are not closed doors, they are open doors. So strengthening the communication skills of all the staff that they engage with in the practices around this can truly help build bridges and help create better patient outcomes and fight and improve the vaccination rates across the state. So, in summary, here are the big key takeaways that emerged from this research that are helping inform the communications campaigns that are coming out largely to basically help support you. That's their whole goal, is to help support those of you, the boots on the ground, to help people re-engage with healthcare providers. So while Missourians feel like they kind of generally know about vaccines, there's a lot of variance across different socioeconomic and racial and ethnic lines, and it's important to be sensitive to those, and that the newer vaccines are where the greatest questions lie. So just being aware and prepared that those are going to be where a lot of the biggest questions come from. So here's some quotes directly from Missourians themselves aching for knowledge in ways that actually meets them where they are. Like, I wish I knew so I could convince my non-vaccinators around me that are how they're endangering their health and the health of their children and the folks who come into contact with them. And the average Joe doesn't know everything when it comes to vaccines. Sometimes I wish they would kind of dumb it down or explain it more in depth. So there's a large, open willingness and desire to learn, just wanting to not feel stupid. Missourians think vaccines are important, but they still have concerns, and they just want to be able to have someone hold space for that and have those conversations and feel like they can be addressed. So they know that they're effective. They know that they can prevent disease. They understand that. They just really want to be heard, to be able to ask questions and get information that's going to help them make decisions. So Missouri residents talk about they're conflicted. There's so much out there, and there's that lack of trust, and there's so much questioning. I want to be able to get information that I can trust, and the healthcare provider is the person that they look to provide that. Missourians do encounter barriers when it comes to vaccination, and they value personal choice. They want to feel like they are a part of the decision-making matrix. It's not just like, here, you need this, and so take it. They want to feel like they are making the choice from an empowered point of view. So they want to say, yes, I know that talking to my healthcare provider is the next step, but I do encounter barriers like, I don't feel knowledgeable, I feel scared. I loved the example that was shared from the Autism Society about, here, let's get prepared and know what we're going to be facing, and then we'll know what to expect. There's just that real hunger for, I want to feel like I know before I go in there. I'm afraid. I am kind of skepticism because of that lack of trust. I'm not interested in it, but the fact that the vast majority are open to these conversations, they expect to have these conversations with healthcare providers, are wide open doors. And they're scared, and that's why I loved when she said, access is access for all. And so meeting the most vulnerable populations allows us to then have tools to meet everyone where they are in this conversation. And then the note about my provider seems judgmental. It's like they really just need to be seen as a person that's trying to make a very personal decision about their health and have that space held for them to do that. So normalizing vaccine conversations as part of standard care. We're going to talk about it every time, so now it's just on the checklist and it's normal, right? So because it's one of those things where, I'm talking about it every day from the healthcare provider, and they probably are, but just not with every patient because it may not be the reason they came or part of the sprained ankle or whatever. So they're saying there is a opportunity here to just incorporate it in the matrix of every interaction to make it normal so that it's always at the forefront and always an opportunity to normalize it and make it it's routine. And then the community health partners also stress that the patients are more apt to pay attention to one-on-one conversations with healthcare providers compared to messaging on flyers and pamphlets. So as difficult and as time-starved as I know everyone is, having space for conversations makes a big difference. So I'm going to go back there. So just knowing that, just increasing that normalization rather than bringing back in 3 months, just taking opportunities where they present themselves when people are there. So strengthening resources that support provider-patient vaccine conversations, totally go and take the Autism Society's VEI stuff. So fantastic. But it is one of those things where healthcare providers and the community health partners both called out that their patients are more skeptical and less trusting, but they know that the consistent messaging and being prepared and knowing what to expect is crucial, and that clear and consistent information to start the conversations and outline the benefits and the potential side effects and can help reduce that hesitancy and fatigue around the conversations, because it's less of a new lift, it's just part of the standard way we have these conversations and engage. So it's one of those things where they have called this out and just making sure everyone's on the same page and the provider resources are available and they can be readily handed out and provided and make things simpler for both patients, but also for all of you as healthcare providers. And then just continuing to honor people's personal choices. We heard in the in-depth interviews and focus groups, and even some providers describing how effective taking that empathetic, patient-centered approach to discussing vaccines, particularly the COVID-19 vaccine, really made a difference in having more effective engagements and discussions and decisions around vaccination. So listening to those patient concerns, providing information, supporting the patient in their decision, and rather than dismissing and not wanting to have the conversation. So just continuing to maintain and hold open space. And so that's where it can change the game. And it makes it less on you to make them make the right decision. You are there walking with them through that and being available as a resource. And providing those guidelines for that patient-centered vaccine conversation. Again, so it's not something you have to recreate the wheel. It's something you have in your arsenal, a tool in your toolbox, as was said earlier in the Autism Society presentation, to have those conversations. So with that, we will leave some space. I'll have Lana come up as well for questions before we dive into the more interactive and hands-on part of our time together.
Thank you for that great information. I think that study done in the state of Missouri was vitally important. So does anyone have any questions for Katrina?
Hi, Linnell Phillips, University of Missouri. So I'm in preparing our next healthcare workforce, and nursing, public health, physicians, and noting that healthcare providers are the most trusted source for vaccination information, and knowing actually how very, very little and scant their curriculum includes vaccination information, number one, and number two, communication skills. And so, anyways, I'm concerned there's a disconnect there, and I'm wondering what your thoughts are on that, and what your advice is to us in academia, and how we should be preparing our next generation of healthcare workers.
Well, I will say a quick thing, and then I'm going to let the expert talk about that. But as far as things go, we did hear some of that from just both from patients and from the healthcare provider themselves, feeling like they maybe weren't equipped to have those conversations, and they felt like their doctor maybe didn't know, even though that was the most trusted person. There was concern around that, and then there were some comments about certain healthcare providers not having adequate communication skills. And so those things I would think would be important additions to the way that the next generation would receive their education. But I'll let Lana, who's more an expert in that.
Sorry, much shorter. So ironically, how many here have actually taken communication training? How to talk to people and how to listen. Oh. There you go. Very few hands were raised. There's a very distinct, how often do we listen to respond and we listen to understand what they are saying? I find that I do that all the time. I hear my husband call and I'm like, oh God, what is he going to talk to me now? And he'll just go, blah, blah, blah. I'm like, uh-huh. And I find myself responding to something I think he said, but he didn't. Communication training is vital because that's where we're falling at. We're failing our patients and we're failing our public because we are often just listening, and I do it too, to respond. I know that's an anti-vax person on the call, and I'm already here when I need to be here so I can quietly listen to their concerns and then inform rather than all of a sudden going, because it never ends well.
Hi, I'm Ken Haller, and I'm giving the next session, and it will be on how to communicate with patients. So I hope you will all stick around, because thank you for everything that you've done, because this sets me up perfectly. Thank you.
You beat me to it, Dr. Haller. I was going to say, stay tuned for the rest of this coming next. We backed them, put them back to back for a reason.
Yeah.
Are there any other questions for the ladies up here? Coming to you, Marge.
I like that we're basing everything on the evidence, that you've done a study and we have some data. So that's so public healthy of you all. And I love that we're walking the talk. But when you say healthcare provider. So when you did the survey, did you explain what a healthcare provider?
Yes. So to clarify on that, we kind of bucketed them together for this presentation, but largely the very top is their primary care physician. So that was the most trusted voice in the room, followed by the nurse. So those were the two most trusted healthcare providers in the space. So I hope that helps clarify that. It was just one of those things where those were the top two very clearly.
Do we have any other questions? Oh, one in the back.
Thanks, great presentation. Could you say a little bit more? You mentioned measuring the demographics of the Missourians who responded. Are there strong differences between people by educational experience, or you mentioned again some differences by race and ethnicity, things that are going to be relevant for healthcare providers?
Yeah, it was one of those things where and I think that those who've had any kind of lengthy public health will understand why individuals who were people of color, the Black and African American, and sometimes the Hispanic, Latinx communities were much more reticent and hesitant and had higher levels of distrust, just given history. And so they didn't want to have that ignored. And I think that that was one of those things where, again, I think sometimes we just want to ignore the elephant in the room that might be influencing someone. And I think that sometimes by not talking about it, we make things worse. Sometimes it's just better to have that recognition. And yeah, there were some things that happened that probably were not right. And I can understand your feelings rather than just trying to dance around it. And then those who live in more rural, and we didn't analyze it by educational level because we focused very much on like location and demographic profiles, but because we were wanting to understand social vulnerability index, those who were in high SVI areas, and understanding if that was a factor, and it absolutely is, when it comes to trust and willingness and understanding vaccines. Those who are more socially vulnerable in those communities are having a harder time trusting and engaging and needing more of that engagement. And that does correlate often with rural areas, but we are hoping to expand our research in the next year to look more deeply into rural communities. So I hope that helps answer your question.
A lot of our healthcare is becoming more and more corporate. In a real push, you have so many minutes to see a patient, and you got to get out and see the next one. And that's what I hear from other providers, and because they don't like it. But that takes a little while to have those conversations. Did you get any information regarding that from feedback from providers, if that is an issue?
Yes, it is. It is something that the struggle that came up most for them has been time with patients, being able to take that time. And I think, it is a struggle, I think, when you deal with systems that are looking for certain outcomes and just wanting to get certain number of patients seen, and that's how they're measuring success. I think that the declining vaccination rates and things like this type of research can help us understand that you can actually shoot yourself in the foot by prioritizing some metric that isn't going to lead to the best health outcomes from an overall perspective. So I think that some of that is going to be some change management and understanding that that's not probably the best way to measure the value and the effectiveness of healthcare, but that's probably a larger conversation. But yes, that was something noted from both the patient side and the healthcare provider side as some of the barriers was just being able to have that time. And I think that also kind of like says, we know they see multiple staff and there are multiple touch points, and we are going to talk about that soon, and ways that perhaps we can make the most of the variety of touch points that patients have to help make those interactions that they do have with those physicians and the nurses as effective as they can be. So I hope that helps.
Hi, I'm on the research team at Lambert with Katrina. And Katrina, I just wanted to ask you if you could piggyback off that a little bit. And while it doesn't save time for the provider, could you talk a little bit about billing for vaccine conversations and counseling?
Yes, thank you so much, Bridget. So that is something that we did find as a side note in the research, is that the majority of the physicians and healthcare providers did not realize they could invoice and bill for those conversations on vaccines. They had no idea that that was even a possibility. And so I felt we have called that out from a larger education standpoint for DHSS to say maybe that needs to be more widely communicated, that it's not necessarily going to save time, but there is a way to recuperate the cost and provide a financial benefit and help prioritize those conversations from a corporate standpoint, that they are important to have, not just from a patient outcome and health, but it's not just a freebie. Like, it's, you can invoice for those, you can charge for those, and insurance, and various things can cover some of those costs. So thank you so much, Bridget, for bringing that up.
All right, do we have any other questions? Okay, we'll head into the next part of
We have one more question right here in the back, and then
okay.
I think we'll be ready to move on. It's a
I'm just going to do a plug for our billing and coding training that's going to talk exactly about what that last question was. It's for free, rural health clinics at the end of May, and then we have a more general one. So Missouri Rural Health Association, any of your organizations that are interested in billing and coding, and they will talk specifically about being able to bill for immunizations. You can check it out on our website. We also have it at our table. Sorry, little plug. Thanks.
Oh, wonderful.
Thanks,
Thank you.
Heidi.
good learning from each other. Yep, thanks, Heidi.
All right, anybody else? Going once. All right, the floor is yours again, ladies.
Right. So we are going to go ahead and share the video that was created out of this research before we dive into Lana's part. So I'm going to hopefully not screw up pushing the play button. Bridget and I laughed. I said, I'm glad someone went before me. Hopefully that means I won't, but stay tuned.
We are at Family Care Health Centers at the Forest Park Southeast location in St. Louis, Missouri. I have practiced primary care in this center for 21 years. I have been really, really grateful to practice in this setting.
We're at Ferguson off of Pershaw Road. Finia Healthcare is a federally qualified health center that provides a wide variety of services to our community. I want to be that someone making a difference.
I grew up about 15, 20 minutes from this clinic. SEMO Health Network in Bernie, Missouri. There's not even a stoplight in town. It is close and dear to me because I was the family member that the family couldn't get to an appointment. I had every vaccine twice because I didn't have a vaccination record. When I tell people about vaccines, it's not because I'm not getting them. Everybody I know gets them, and I highly recommend them because it protects everybody.
Vaccines are an integral part of preventive care, primary care, holistic care. It is one piece of what we do in primary care to promote someone's health and to troubleshoot problems that they're having.
We talk about vaccines starting from that first visit. I try to see where they're at and why they're opposed first. I leave it as, I understand your concerns. I do always say I am pro-vaccine. I support every vaccine that is recommended by the vaccine board and on time schedules, but I will work with you. I will respect your decision, but I will always ask you about where you at with this decision. The first and foremost thing is that I like to approach everyone with the understanding that we all want to do what's best for the children.
I think it's important for us to acknowledge how our culture is changing. Never before the pandemic did I ever experience a patient having an emotional response to me asking if they would like a vaccine. It's triggering. So being attuned to our patients is really key. Sometimes when a patient declines a vaccine now, they'll sometimes take it in the future. Another recommendation is to try to have those vaccines in the clinic immediately available whenever possible.
I think parents do feel overwhelmed with the actual injections. It's nice if facilities can stock the combination vaccines when you can reduce those number of shots, but also just letting parents know, like, hey, their body can handle it, and it's better to do multiple shots at once instead of bringing them back repeatedly and each encounter them needing to go through that trauma of getting shots. I let them know that we have studied extensively the number of antigens that are present in the vaccine that kids are exposed to, and let them know that it is safe and effective. Since babies are born, they're exposed to hundreds of thousands of antigens. What we're putting in their system is like a drop in a pool based to what they're seeing on an everyday basis. So their immune system, if they are not immune compromised, can handle it. So I try to help parents to understand that part of the thought process of why I recommend that you get them all that day.
There is no public transportation in Southeast Missouri. A lot of families don't have vehicles. The inconvenience is very hard on patients and families because they just can't get to the places they need to go. When they come in for a sick visit, you have to try to get that child back for a vaccine or even an adult back for a vaccine. And that's not their priority. Their priority is they're coming in because they're sick and the vaccine is the least of their concern. So what we try to do is do as much as we can at one visit, which a patient's in a 15-minute spot, the kid doesn't have a fever and they're healthy enough to take a vaccine, the mom's okay with it, give the vaccine because it may be the only time you see that kid that year.
I would just recommend not to take an all or nothing approach. I would suggest educating yourself beyond what is provided in the medical education system. Become familiar with the trends because they do affect your everyday practice, how people on the internet are kind of providing the information so that you can knowledgeably and accurately kind of dispel some of the myths that are going around.
The more that we can recognize trusted messengers, collaborate with them, leverage them, the better. Very often a patient will tell something to someone on my team that they don't feel comfortable sharing with me, or they may take a recommendation from someone on my team more than me, and I honor that. Every member of our team has a level of expertise that is equal to mine. It's just that we all have different forms of expertise. Being a primary care doctor is very similar to being a mother. You can't control the other person, but you can guide, you can educate, but most importantly, if you respect and empower, then that individual may make choices for themselves in the right direction.
Now, as a primary that works close to the community, I'm helping these people that helped raise me. And I've watched them grow and I've watched them pass. And they helped raise me through life to make me the person I am, and now I'm able to help them. And as providers, that's all we want, is to help people and educate.
So how do we move the needle in a positive direction? One of the things we know, you have to be positive. What is your vaccine attitude? Because whatever your attitude is actually displayed to the patient. In fact, vaccine hesitancy on the healthcare provider's part has been identified as a barrier to vaccination. What mindset are you in? Did you just come from somebody that you just had that anti-vaccine battle with, and now you're into the next clinic? What's up here comes out here. Our partners at WashU did a huge study on HPV. They went in and did practice facilitation. And one of the clinics they visited, the physician's like, oh, I love this vaccine. I promote it, but none of my patients take it. So like, do you mind if we record your interaction? They're like, sure, you can see. So they got the parents and patient's permission, and they went in with the doctor and recorded the entire interaction. And of course, the parent and the patient left not immunized against HPV. The provider says, see? And she's like, did you hear yourself? You talked them out of that vaccine. Let me play it for you. And she was like, I didn't realize that was coming out of my mouth. So be in that mindset. What you say matters, but also how you say it. We talked about, one of the questions was provider time. Vaccination should be a team effort. It's everybody's job. It shouldn't just be one person's job in the clinic. What you say, what your clinic team says, what your clerics, front desk staff says, it all matters. Everyone should be on that same page when they answer the phone, when they check that patient in, and when they leave. Educate, educate, educate. Education is a key to success. You don't have to go to a huge school. You can do webinars, online trainings, stuff like this, conferences like this, VFC 411. Education is a key component to increasing vaccination rates. And communication training. Like I said, we listen to respond. Everybody does it, I do it. But we need to listen to understand. And that is a skill that needs to be taught. Our staff does a lot of communication training anymore. And we did one huge one, and it was funny because we all skipped, I think, the second step that we were told to do. We went down the road, and then they said, did you read the second step? And the second step said, you're done. We did everything else on that page. We could have stopped at the second step. Who knew? What do we know about vaccine hesitancy? It's usually delaying getting the shot. Often we do it because they're either a cautious acceptor. That means they're gonna do it, it's just kind of on their time frame, and sometimes they want more information. Some people have concerns, and that's fine. We need to educate and be knowledgeable. Hesitant and refusers are two different things. Hesitant people you can motivate to go toward that vaccination route. Refusers, 99% of the time, you're not gonna make a difference. 99% of the time, I'm gonna say, I don't waste my time talking to them because of that. However, your hesitant parents and patients, you can make a difference. They can be that moved. Is hesitancy increasing? What are your thoughts? Do you think it's increasing? It's about the same, actually. 74% of people will get a shot just because it's the norm and recommended. And then you have your vaccine refusers, about 5% of the population. It used to be 3%, it's gone up a little bit. So basically, though, the hesitant are the in between, about 20%, and that really hasn't changed much. What you're hearing is louder voices. So what has increased is disinformation and misinformation. And we can deal with disinformation and information in a few ways. I'm gonna point out two of the easiest methods right now. One is creating a truth sandwich. How many have heard of that? Truth sandwich? A few, okay. So I'm gonna give an example, because this really happened. The COVID vaccine is now routinely recommended vaccine. It's placed on the schedule. Misinformation. They are mandating that COVID-19 vaccine because they placed it on that vaccine schedule. The government's mandating it. How many of you have heard that? I know news organizations have published that. Fact, vaccines that are placed on that ACIP schedule are done so to ensure coverage. That's the only way private and public insurances generally pay for a vaccination is if it's on the schedule. That was the big reason why they placed it on that schedule, not because they were mandating it. But you didn't hear that in the news cycle, did you, or online? Again, people remember the first and the last thing you said. Truth sandwich. The other thing you can do is try to build confidence, build vaccine confidence. Vaccine confidence is important. It's defined as the trust individuals have in the vaccine and the healthcare system recommending that vaccine. Low vaccine confidence decreases your vaccination rates, increases the spread of mis and disinformation, and creates barriers of trust and uptake. Make sure when you're dealing with vaccine information, you're giving it timely, and accurate information on the vaccine. Listen to understand what the concerns are, and answer the questions and provide the guidance. Give them the resources you want people to have, not Google. Google is not our friend. How can you build confidence, especially in your vaccine practices or in your clinics? What vaccine schedule are you seeing in your clinics? Which vaccine schedule? What's the date? It should be 2024. I was at a clinic in the fall, and I'm like, well, what schedule do you have? And they're like, oh, it's this one. It said 2018. I'm like, hey, it's 2023. Let's get you a new schedule. New schedules are published every February. You can either download it, you can come, we have new ones out there. Pick one up. That's the one you need. Use the immunization information system, ShowMeVax. We are connected to several different states now, the VA, and we're getting more and more providers onboarded. So please, sign up, it's free. Don't wait to talk to patients about vaccines. Use every opportunity. Prenatal visits. When they're choosing pediatricians, that's the time to talk about what vaccines are. When mom and dad come in for that first visit without the little one, what's your policy? Sick visits, well visits, sports physicals. If I broke my leg, my arms are fine. I could get a shot. Can you and your staff answer the following questions? What are the common side effects of the vaccines you administer? What can be done to help with those side effects? How do we know the vaccine is safe? Where can I get more information? Use non-technical language, and I find that I do that a lot. I will spout off something to my husband, and he'll look at me like I just spoke Greek. And he's like, I didn't understand a word you said. I'm like, okay. And then the final thing you can do is make that vaccine recommendation. It matters more than you think. So let's talk about safety. Do all vaccines go through the same testing and trials? What are your thoughts? Did COVID? Yes, it did. It did. It sped up, but it did. People don't understand that. COVID and all vaccines go through preclinical and clinical trials. All data, good and bad, are given to the FDA, sent when it's seeking licensure or authorization. So they can make an informed consent decision on whether to recommend or not and authorize. So when people say, oh, Operation Warp Speed, that meant it didn't go through anything. It did. All it did was, instead of companies having to recoup cost that they've invested, the government upfronted all that cost, gave them the knowledge and the ability to grow the virus, manipulate it. That was all done and given to them. That's what helped speed that along. So yes, every vaccine goes through that same trials, and all the data is available. Once the vaccine is authorized and licensed, do we monitor it then? What's your thoughts? Is it like Tylenol? Once it's out there, it's out there? No. FDA does monitor each lot that goes out. That's one thing parents don't understand. It's a never-ending cycle. Also, FDA routinely inspects all manufacturers to make sure the plants are safe and doing that vaccine properly, or producing it. 3 systems are used in the US to monitor vaccine safety for the most part. There's a few others, but I named the top 3. There's VAERS, Vaccine Adverse Events Reporting System, Vaccine Safety Data Link, and CISA. With the Vaccine Safety Data Link, there's also the Post-Licensure Rapid Immunization Safety Monitoring. The difference is, VAERS, anyone can report. If I went and got a tetanus shot and my arm hurt, I can report that, even though that's a common side effect. And that would be fine. Anyone can report what they think would happen. However, it's a passive system, and it also doesn't show that there's a causality between a shot and something that happened, a side effect. I could go to the Columbia Boone Health Department, get a Tdap shot, cross West Worley, get hit by the bus, and die that same day. That would be a death reported to VAERS because it happened after vaccination. Did the tetanus shot kill me? No, it was the bus. But people say, well, that person died, they got a tetanus shot, and that's what you hear. The VSD and post-licensure rapid immunization safety monitoring, they look at real-time data. So this occurred especially with COVID-19 and the Janssen vaccine. When VAERS was alerted that, hey, could be an issue with blood clots in this vaccine, then they started pulling in the VSD and PRIS, P-R-I-S, to see if this is really occurring. They look at real-time data in these EHRs and EMRs. Then the Clinical Immunization Safety Assessment Project looks at it as well. And we know this works because what happened? What happened to J&J? As soon as they noted that this was occurring, the vaccine was locked. We asked everyone to stop using it, quarantine it, while they finished their investigation, and then new parameters were issued. So we know this works. Do you explain some of this to your patients? Because they're worried about safety and efficacy. So you gotta have some kind of knowledge going into these discussions about this. Each person administering a vaccine should know a few of the most common side effects. And I'll give you an example. My daughter was one, a long time ago, and I took her to the doctor for her MMR vaccine. I'm a pediatric nurse, worked at Children's for 7 years before I had kids. I called the doctor up and I said, she's got measles, she's got a rash head to toe. I don't know what to do. And he's like, she just got her, when did she get vaccinated? Oh, about a week ago. Oh, well, that's just a side effect of the vaccine. No one told me. No one told me that. I guess I could have looked at the VIS, but as a new parent, you just want to go. So, but when I was dealing with shots every day, I would tell parents, hey, that tetanus shot, it's going to make your arm hurt. Warm water, shower. If that baby, DTaP's going to make his thigh hurt. Get him in a bath, rub the site. Hey, he had an MMR shot today. This is going to happen. It could happen in about a week. I just want you to know these things so that they're prepared. And then, hey, if you have issues, feel free to call us so that they're knowledgeable. And can your staff answer some other questions? You know what? Everybody's like, oh, well, I wish I had those answers like you. I look up things every single day of my life. Google sometimes is my friend. So it's okay not to know the answer. I was on the phone call with some gentleman and he had some concerns. And I'm like, well, hold on, let's look that up together. And I'm like, okay, this is what I'm doing. And he's like, oh, okay. After I got off the phone with him, he's like, oh, okay, thanks. All right. If you admit you don't know the answer, sometimes I'll say, that's a really great question. I haven't had that before. Let's look it up. It actually builds a little more trust because you're seeing that, oh yeah, you do some research yourself. You do know. Can your staff answer those simple questions? What training is done for your staff? The IQIP nurses in the back, and I do provider visits. You would be surprised how many times we go to visits and we're like, so what kind of training does your staff get? Well, we trained on the EHRs. Great. Do you get any training on vaccines, administration, spacing, scheduling, how to read the record? No. One thing that we know, you need to train. You need education. Education is important because the more confident your staff is, you are, the more confident you appear to the patient and their parent. That helps a lot in that trust. So the next thing we often get is questions on recommendation and requirements. So what is the difference? Here it is for you. Basically, recommendations are the standard of care. That's what expected as a medical provider. Requirements are made by legislatures, governments, employers. It's not the same thing. But when you talk to a patient, how many say, well, these are required, then they're not going to get any other vaccines because you just told them they weren't important. Strong recommendation. We know healthcare providers are still considered the most trusted messenger. Communication on vaccine is known to be a factor in vaccine acceptance. So what is your vaccine attitude? I feel so passionately about the flu shot. Everybody in my family gets it, and the dog gets one in July. I'm pro-vaccine. Everybody got COVID vaccine. Everyone, believe it or not. I'm like, you come into my house for Christmas, you're getting that shot. I don't care. And that's fine. If I'm going to talk and speak about it, then I have to live what I talk. Can you say the same thing? If you're hesitant on a vaccine, it's coming across to the patient. How many here have teenagers or adolescents? How many of them already are vaccinated against HPV? Mine both were. My sister's like, oh, well, the doctor didn't really think it was important for my son. I'm like, oh, so you're okay with him getting cancer? And she's like, oh, okay. So yes, I am that person. But your attitude does come across. And that's what you got to think about. What attitude are you portraying to that patient? Oh, no, I'll go back for a minute. As you can see, 76 parents are going to decide if they should get the shots based on what you say out of your mouth. If you don't say it's important, they're going to say, okay. And here's one more quick story for you. Last July, I had an injury. I went to an urgent care where I live, and I got 17 stitches in my leg. 17 stitches. It was a pretty bad injury. No lie. They cleaned me up, stitched me up, and the physician assistant comes back and says, so generally we recommend that a person gets a Tdap after this. What's your thoughts? And my husband's like, oh God. And I'm like, I just cut my leg and got 17 stitches from a carton Lowe's. Of course I want a tetanus shot. And she's like, oh, okay. So I go back a few weeks ago because I had an asthma exacerbation. And I go in, and she's like, are you sure it's asthma? Yes, I know it's asthma. And she's like, well, we're going to do a chest x-ray. I'm like, okay. So we go do this chest x-ray, and we come back. And she's like, you're right, it's asthma. We're going to do a steroid shot today. There was no question there, was there? Vaccination should have been the same question. This is what you're going to do today. Because if you don't think if it doesn't come out of your mouth that it's important, then it must not be important. So, what makes that strong recommendation? It should be clear, concise, and consistent. Everyone should be getting the same message and the same thing. It should be rolling off that tongue of yours. Hey, your child is 11 years old today. He needs a tetanus, HPV, and meningococcal vaccine. Those will protect against whooping cough, certain cancers, and meningitis. What questions do you have? It should roll off your tongue. If you're going, well, it's required for a Tdap and meninge, and then we also have this other vaccine. Then you just the HPV one, people say, oh, I don't know why nobody takes it, because you didn't recommend it. That's what's the question. So how do you handle those vaccine hesitant parents? Because for the most part, most of them will get the vaccine if you recommend it. Hesitant people, you always start with that same recommendation. Clear, consistent, and concise. And then you're like, so what questions do you have? sure Dr. Haller will do a great job later. And then you can say, hey, well, listen to what? I'm going to listen to their what? I'm listening to hear, listening to understand. I'm not going to listen to respond. And that's what you've got to start doing. What are their reasons? And if they say, hey, you know what? I don't know. Okay, well, here's literature. We're going to talk about it again. So they know that. The other thing you can do is there's listening, motivational interviewing, that open-ended questions, restating your question so you understand exactly what their issue is, and the dispelling the myths or misinformation. One thing people don't understand is that if you repeat that myth, then it must be true. So, like, I get a lot of questions. All the vaccines have mercury in them. Do you ever get that question? So what's the statute in Missouri about that? Did you know there's a statute about it? April 1st, 2007, no vaccines given to children under 3 or pregnant women can have thimerosal in it. Did you know that? So the only vaccines that we have that have thimerosal generally are our multi-dose vials of flu. People don't know that though, do they? Because they don't go on the DHSS website and look that stuff up. I do. So it's really important to understand, to give them that information. And then ask to share. Lots of times when I was giving shots at the St. Charles County Health Department, I'd say, hey, can I tell you why I got my child the HPV vaccine? Or I think at the time it was the meningococcal vaccine. I'm not there to say, don't touch that, don't put that in your mouth, don't share your water bottle. So I'm going to give my kid the healthiest chance. I did the same thing with HPV. I gave both of them an HPV shot because I did not want them to get cancer in their 30s or before that. And you know what? When you tell people that stories, they kind of listen because they're like, oh, then it must be important. She did it for her family. That's true. If I could have it, I would have gotten myself the HPV shot. What else can you do to build your recommendation? Assess the vaccine history so you can see what they have, what they haven't. Consider asking them. In adult world, we ask them, what do you do? Where are you going? Because all that plays into that, what you're going to recommend. Also, remember, you are vaccinating on the age they are today. So if somebody comes in and they skipped all vaccines till they're 8 or 9 years of age, you're not vaccinating back to their infancy. That ship sailed. They're not going to get Hib or Prevnar unless it's a medical reason. So you're doing it from today on. Announce what they need. And if you don't have that vaccine, where are you sending them? Do you know? Have some places all ready to go so they can go and get that vaccine they need. All right, we're going to display the answers, and then we're going to play a short game, and we have prizes. So you participate.
Yeah. All right, guys. We've got very little time left. We know we've overloaded you with information, so we want to end with fun. So it's a 10-question Kahoot, super simple, but we do have adorable prizes for the top 3 folks. So y'all, come on in and enjoy the Kahoot. Here we go.
You're going to answer the question.
As quickly as you can. Right. It's as fast, right?
Yeah.
3, 2, 1.
Answer.
True or false? Multiple vaccines administered at the same visit overwhelmed the immune system. Just click your answer fast as you can.
Fastest ones win.
Yep, fastest and correct.
Yeah, correct.
Yeah. Just not, I mean, just see how wonderfully smart you all are. All right, 2, 1. Boom, fantastic. Well done, y'all. Okay, next. Showing my southern roots. There's a scoreboard. Terrell is in first place, Stacy, Candace, the unit, and Maria. True or false? Vaccine should be deferred during mild illnesses. True or false? Mm-hmm. Ta-da! It is false. Well done, all. We will look at our scoreboard again. Maria has taken first place. Savvy and Candace. Next. Preterm infants should be vaccinated according to gestational age. True, false, true except for hepatitis B, or false except for hepatitis B. I know we had to throw some tricky, I'm saying, like, it couldn't just all be true.
We have to have a challenge.
Most of these are Lana's questions, so don't throw things at me, right? All right, that is false except for hepatitis B. We're going to change up the game here. All right. A. White, St. Charles County, C. Ship, and a unit still in there. All right, here we go. True or false? Benefits of vaccination outweigh the risks. There we go. True. Dun, dun, dun. Leaderboard. Da, 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 da. Okay, here we go. True or false? Influenza infection is not severe enough to warrant vaccination. True or false? Bridget will have to add, jazz music or something next time. Yeah. All right, that is false. All right, let's see the leaderboard. Dun, dun, dun. All right, true or false? Children and adolescents only need the vaccines required in Missouri to attend school. All right, that is false. That was a tricky one.
All recommended vaccines are needed by children.
She's the teacher. She's the teacher, y'all. All right. True or false? Provider vaccine recommendation is associated with vaccine acceptance. True or false? That is true. Ding, ding, ding. All right. Leaderboard. Ooh, St. Charles. Oh, you guys are kicking butt over there. Mull, KW84, the unit, and 3 N's. All right. Last 2 questions. or 3, HCPs and Missourians largely agree that vaccines are important. True or false? HCPs and Missourians largely agree vaccines are important. True. Y'all are like, yes. 100%. Everyone was paying attention. Yes. All right. True or false? Missourians are not open to discussing vaccines with their healthcare providers. True or false? False. That is correct. All right. Here we go. 10 out of 10, last question. Missourians say they trust healthcare providers the most for information on vaccines. Dun, da, da. All right. The podium. In third place is KW84. Congratulations. Mole Chap is in 2. And number 1, St. Charles Co. Very good. All right. Come on down. Okay, the top 3 winners, number 1, 2, and 3, come and you win. Yes, one person from St. Charles County. Yeah, you have to share the prize. You have your choice of an adorable giant microbe. So, come on down, y'all. Yeah, fantastic. Thank you guys for such a wonderful session. Please feel free to take those handouts, and they will be made available as well. So, thank you guys.
Thank you for such a great presentation and the fun activities that went with it. And so we will be heading into our final break session for the day, and we have snacks available. Not supposed to be by the speaker. If you have on your table one of the sign-in rosters from the Missouri Immunization Coalition General Membership, we're lacking one. So if you have, I see it back there in the back. So we will reconvene at 3:30.